One of the main challenges that we face in the area of mental health from a global perspective right now is that despite knowing that the burden of disease represented by mental, neurological, and substance use disorders is really high, and despite knowing that some of the mental health conditions are among the highest causes of disabilities worldwide, such as the case of depression, we are still facing challenges when talking about how many of those who need treatment or care receive it. So, one of the main challenges when we talk about health for all is that unfortunately, those with mental health issues do not necessarily receive the care they need. So the alternatives, the strategies that we are trying to put in place are related to a number of initiatives that will go to move from the highly specialized care and services to the integration of mental health at primary care level, at with other diseases, with other morbidities, so that we tackle the comorbidity related to mental health and other non-communicable diseases or HIV or TB or other conditions that are usually less perhaps stigmatized than mental health is. So how do we integrate mental health there? How do we really work hard to ensure that we strengthen the capacities of those working at different levels of care to deal with mental health? But also on top of all of this, I think that it is important to bring the message that we are using this year for to celebrate the Mental Health Day, and that is that we need to work on suicide prevention. We are calling everybody for 40 seconds of action. We know that we can prevent suicide if we take action to do that. One person dies by suicide every 40 seconds. So we are inviting everybody to take action and to do something to prevent suicide, to talk to somebody, to share the news, to ask for help, to take an initiative that will address this enormous challenge that is affecting everybody everywhere, but is particularly a concern for the youth. So let's all do something to prevent suicide, and we will do it together.